require me to carry that many bones at once. Take a bone at once, don't do what I just did. Okay. Placing the glenoid or the humerus in the anatomical position requires you to know structures that are on the distal end. You're going to have a small fossa. This is for the coracoid process, and that's anterior facing. Posterior, you have a larger fossa. This is known as the acromion fossa. Okay. This is where the acromion process, which is your elbow bone, will fall into during extension. With flexion, the coracoid process falls into the coracoid fossa. Okay. Now, what side is this, after knowing that? The head always faces medially. Huh? Yeah, you're looking at the anterior view. Remember, the head of the fossa faces, the head of the humerus faces medially. Right. Okay? This is the right one. Right. So let's look at some structures. Unfortunately, this bone is decayed and weakened. This is called the greater tubercle. Just medial to that, you have the lesser tubercle. In between the two tubercles is called the inter, the Greek meaning in between. Tubercle, in between the tubercles, is a groove. And this groove is where the long head of the biceps, brachii, crosses through and attaches on the superior portion of the glenoid fossa, of the scapula. Okay? It's another problem, PTs, OTs, of this tendon slipping out of joint. Okay? Light or strong traumas. Then we have what we call the anatomical neck, which is in this direction around the head of the humerus. And below that is the surgical neck. Okay? During shoulder replacement surgeries, this is where they cut, take this off, and use surgical steels and plastics to get the humerus to articulate with the glenoid fossa, stay strong. You also have a diaphysis. Remember the epiphysis and the diaphysis. Then on the medial side, you'll see that the medial epicondyle is larger than the lateral. That's another clue to tell you what position is the anatomical position for the humerus. The medial, so this is going to face medial, okay? Let me get anatomical. Epicondyle, and the smaller one is the lateral epicondyle. Okay? Now, you're going to have two bones that articulate with the distal humerus, and first of all we find the ulna. The ulna is the longest, strongest bone of the forearm, okay? Because the radius is only going to articulate with the ulna, with that in between here is interosseous membrane. Okay? And that allows, when we go from supination, and this is supination, to pronation, the radius crosses over the ulna. Boom. Radius crosses over on pronation. To get them side by side, you have to be supine. Okay? Now let's look at the parts of the distal humerus that articulate with those two bones. First of all, the radius is going to articulate with the capitulum. Capitulum. Radius articulates with the capitulum. The ulna articulates with the trochlea. This is a larger bone, and it runs from the coracoid process down to the olecranon process area. Now, looking